My name is Dr. Shante Sullivan-Pike, and I am a reproductive endocrinologist. In my practice, I help patients understand what's happening to their bodies as it relates to reproduction and options they may have to conceive. Here at Parents, we wanted to break down some of the biggest topics around fertility and more in 3 minutes or less. For those looking to conceive, here are some basic things to know about your chances of getting pregnant when practicing penis and vagina sex or considering other options to conceive. So what is menstruation? Menstruation is a shedding of the inner lining of the uterus called the endometrium. Menstruation occurs in the absence of fertilization of an egg and subsequent implantation of an embryo. In early pregnancy, a structure called the corpus luteum, which forms after the release of an egg, is necessary for the production of the progesterone and estrogen levels that support pregnancy. The pregnancy itself produces the hormone HCG, which maintains this corpus luteum until the placenta later takes over the production of hormones. If pregnancy does not occur, HCG is not produced, the corpus luteum resolves, and the levels of progesterone and estrogen decline. It's the withdrawal of the progesterone and estrogen which then induces changes in the endometrium, which causes it to shed in the form of menstruation. So what are your chances of getting pregnant right after your period? Really quite low, less than 5%. This is because it typically takes about 12 or 14 days from the start of menstruation for the ovary to develop a mature egg and for ovulation to occur. This period of time is called the follicular phase of the cycle. Furthermore, the endometrium itself is typically not receptive to implantation right after the completion of menstruation. Your chances of getting pregnant are highest in the so-called fertile window, which is the 6-day interval ending in ovulation. Ovulation is the release of the egg from an ovary. Peak fertility is typically observed when intercourse occurs within the 1 to 2 days prior to ovulation. Once ovulation occurs, the released egg lives for only about 24 hours, so the chances of getting pregnant right after ovulation is very low, less than 2%. Furthermore, due to hormonal changes, the endometrium undergoes changes that prevent implantation beyond this point. So what are other things you need to know? Well, 80% of couples will be pregnant after 6 months of trying. Because menstrual cycles vary from month to month, it may be useful to use an ovulation predictor kit to help with the timing of intercourse. When the kit shows peak fertility, we recommend intercourse that day and the day after. However, because ejaculated sperm is viable for up to 5 days in the uterus, it's also important to have regular penis and vagina sex during this time.